More and more sugar substitutes are being deemed unhealthy, with their side effects ranging from heart attacks to cancer. There's a new study that links a widely used sugar substitute to heart attacks, strokes, and premature deaths. And a lot of you may say, well, I don't use sugar substitutes. I don't put sugar substitute in my tea or coffee, and I don't eat sugar-free candy or jams. And I would say, good for you. That's wonderful. Unfortunately, this substance, this sugar substitute, is so widely used that a lot of us don't know that we use it on a daily basis. And not only daily basis, we actually use it more than once a day. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. So today we will be talking about xylitol. Xylitol is a sugar substitute, and it is present in many of our toothpastes. Actually, the first thing that I did when I read this study, I looked at my toothpaste, and unfortunately, it does contain xylitol, and a lot of brands do, but not all of them. So let's talk what xylitol is. So xylitol is actually a naturally occurring sugar alcohol, and it has lots of good qualities. It occurs naturally again in some fruits such as berries and plums, and in trees such as birch. And the good qualities is that it has antibacterial properties, and especially for mouse bacteria. That's why it is used in dental hygiene. So it is used in toothpastes. So the second good thing is that it also has antifungal properties, and it is good against some strains of Candida. Additionally, it is as sweet as sugar but has 40% less calories. And along the same lines, actually, it has a lower glycemic index, actually, of 7 compared to sugar's glycemic index of 70. So those are the good things about xylitol. Now, bad things. The bad things is that, first of all, it's not good for your gut because it does cause havoc in gut microbiome, and clinically, you may also develop diarrhea, bloating, gassy sensation, which is similar to other sugar substitutes. So now this new study has shown that people who use xylitol a lot, and how do they know it's a lot? Obviously, they measured the levels of xylitol in their blood, and they followed 3,000 people over 3 years, that these people have a higher rate of heart attacks, strokes, and premature deaths. And why does it happen? It happens because xylitol does something to platelets and causes abnormal platelet aggregation, which leads to blood clotting. And blood clotting is the initial mechanism that gets the cascade of heart attack and stroke going. So it's basically one of the initial steps. So this, of course, is a very concerning data. How do we interpret that? So uh, it's one study. Obviously, we need more data about it, and I don't want to say, oh, use don't use any xylitol containing product. It's actually very hard because xylitol is also present in sugar-free gum. It's a major component of a sugar-free gum. It's in mints. It's in many sugar-free candy, for example, sugar-free sweets. It's in sugar-free gels. It's in some nasal sprays and pharmaceutical products. So it's in many things. So we can't really say stop using it because sometimes we're not even aware that we are using it. So I think that everything is in moderation. So trying to not to overdo on certain things. And I would stay away from any sugar-free sweets because they have lots of side effects in addition to these findings. So, but meanwhile, in terms of the toothpaste, I definitely would think that switching to another brand is a good idea. And additionally, I would make sure that you rinse your mouth well and like spit out the toothpaste. Try not to eat it. That should be helpful as well if for some reason you can't or you don't want to switch your toothpaste brand. Thank you so much for watching. Until next time. Bye-bye.